everyone. Happy Wednesday, or whenever you're watching this. My name is Danny. I am the patient care coordinator here at TherapyWorks in Lawrence, Kansas. And I am here today with Mark Hurley. He is one of our PTAs here, and we are talking about gait disorders. So, to kick us off, what is a gait disorder?
Well, first of all, I think the word disorder is kind of a bad word. I wouldn't say there's anything wrong with it. It's just if we look at what the standard mechanics are, like the heel to toe and the natural gait, anything that's a deviation from that, whether it's a narrow stance or a shorter stride or anything that's out of the ordinary. So first of all, I wouldn't say that there's anything wrong with you. There's just ways to correct it. I liken it to if there's like a wobble in the tire or maybe low pressure on the tire and the car may not just like go perfectly, but it'll still go, right? So I always think, when you see somebody, we do this a lot when we were in school, assessing people's gait, just total strangers walking down the street. And so you might say this one's can be improved with this or this one can be improved with that. But so not everybody's perfect, but I didn't want you to think that disorder was a bad word. It's just everybody has one way to get that job done, getting from point A to point B, and so what we do here is just kind of we assess the fine details of that and maybe change a few things or improve a few things so that it is more like the fresh set of wheels on a car, that kind of thing.
Awesome. Okay, and what causes gait disorders?
Well, gait disorders usually occur from either a injury or like compounded misuse or repetitive use or just kind of like doing one pattern one way for so long that it becomes natural and it feels natural to you when another person may be looking at it and saying, that can be, that this is off, or your leg length is off, or your pelvis is off. So another cause would be, it could be natural disease, could Parkinson's disease affects the gait, a fenestrating gait, a shuffled gait, a shorter stride. Stroke can affect the gait with affected side, left or right, so that you have weakness on one side compared to the other. Or just leg length discrepancy can affect the gait. Nagging small injuries can really affect the gait. We can kind of go into that later. But so several things, just natural, either natural or genetic issues can affect someone's gait.
Okay. And are there things we can do to help?
Oh, absolutely. Well, the first thing we would do is obviously if you feel like something may be wrong, there's a hitch in your get up or whatever, we'll assess that. And we have clinics. We have a runner's clinic coming up, but there's some ways you don't have to have a doctor's appointment, or you don't have to think you have something severely wrong with you before coming in. So it could be just as simple as, hey, can you watch me walk on the treadmill for a little bit? Or my husband's saying I'm limping a little bit. So it can start with that. So first it would be an assessment of how your walking style is, kind of fine-tuning if there was a muscle discrepancy, a strength discrepancy, if there's pain. So we would find all those variables and then work on how to improve those to improve the gait and make it more natural, more mechanical, more regular.
Okay, wonderful. And what exactly is the problem with a gait disorder? What are the risks of not solving it?
Oh, good question. And a lot of people will go too long before getting any help for it. So, a risk would be, like coaches would say, are you hurt or are you, you're injured or are you just hurt? And so oftentimes people will feel that it may just be a soreness or maybe just a twinge here or there, and then they keep doing what they're doing, treadmill walking, biking, swimming, running, or a sport, and then it compounds later. And so not seeking it early, seeking any help with that early, can absolutely lead to bigger problems. If you are modifying your gait, you can increase hip pain, you can increase back pain, ankle pain as well, you can roll ankles. So there's several things that can go wrong if you wait too long. And it also could be caught early enough where the side effects are not as bad. The recovery is better. The progression through your rehab is a lot easier. So catching it early, like you do with anything, an illness, preventative stuff, that kind of thing.
Right. Okay. Awesome. And when someone has a gait disorder, what are some stretches that they can do to help?
Well, first of all, it would be isolated to whatever body part would need it. So, if, for example, if they're walking with a little bit of a flexed trunk, perhaps their hip flexors are a little tight. So a nice stretch for the hip flexors are like above your quads. So if those are tight, you may be kind of hunched forward a little bit. So straightening those out may improve the standing posture, may improve your stride length a little bit. Another stretch we can do is for like the inner thighs, the adductor muscles, the tight groin muscles. Those may pull your stance in a little bit, so a nice butterfly stretch or an adduction stretch will help widen your stance, improve your lateral weight shifting, and just balance. And then the back stretches as well, because postural may be an element too that needs to be addressed. So core strengthening, so stretches for your back, stretches for your abdominals, obliques, and then of course hamstrings. Most of the time, the athletes, runners, or just average Joes will have tight hamstrings. You'd be surprised, and you don't know it until you're starting to get them stretched out. And so, and absolutely, hamstrings can affect your comfort and your stride length, especially if you're changing speed. Boy, nothing worse than a little twinge in your hammy when you're going from a jog to a sprint or something. So
that's right. Yeah.
So proper stretching is very, very important. It all comes together with what we try to do to improve your gait. So stretching is a great component of that.
Okay. And what about exercises or motions to help improve gait?
Well, like the stretches, we'll see what is weaker or what needs that attention. So exercises can be the repetitive kind, where you're doing the bike or the treadmill, or it can be closed chain like leg press, mini squats, lunges, those kind of things, where your foot and knee and hip are all kind of in a closed chain where the joints are kind of working together to do that motion. Other exercises to do, standing where you're like spreading the one hip out, or the hip range of motion where you're doing the three-way, which will improve kind of the fluidity of the hip joint and strengthen all the support muscles of the hip. So those are all used during your walking, your running, that kind of thing. So that's just a couple, but of course we would, like we mentioned before, find where there's areas that need that improvement, and then we would isolate those muscle groups and find exercises to improve those areas.
Okay. And what are some good ways to avoid gait disorders?
Well, like we had said earlier, don't wait too long. Don't think that it's going to go away. Oftentimes it may not, or you'll walk it out or run it out, and it just doesn't go away or doesn't get any better. Maybe it gets worse. So avoiding that, I guess it would be to kind of suck it up and say, perhaps I need to get this looked at before it gets too bad. So that's one way to avoid it, is don't do nothing about it. Don't procrastinate, or don't just think that it'll resolve itself. Other ways are just maybe having just a second person look at something that you may think your style, your stride, your walking pattern is normal, but having a second set of eyes on there, whether it's a health professional or just a friend that's saying, hey, you look like you're swaying when you walk, or one foot's dragging every now and then, those kind of things. So you may not notice it because you're used to it. You're used to knowing your body, and it doesn't feel like you're doing anything wrong, but having a second person kind of watch that as well. So maybe just a second eyes on it. So, and just don't be too sedentary. It doesn't take too long before we atrophy some of those muscles or the joints get stiff. And so staying active, during the winter, it's hard. You got to find something to keep you going. So whether if it's an indoor activity or just sitting in your chair and, doing your maybe chair aerobics or chair movements, or just doing stuff around the house, So we know we have several patients here that we help that if they don't like to go outside and go hit the trails, but there's several things that we can do inside and indoors in a comfortable setting. So lots of stuff we can do.
Okay, awesome. And then how do I know if my gait is bad enough to get physical therapy?
Well, let's see. Well, if one easy way to see is if you're like wearing improperly on your shoe, perhaps rolling out the ankle, rolling the heel down. Maybe your heel strike's bad. Maybe you're wearing the toe off in the foot. So maybe your push off is, or maybe you're shuffling that. So you're wearing. One way you can look at your bottom of your shoe and see if what your wear pattern's saying. That's an easy way to say, hey, all right, so something might be off. If one shoe is looking like there's a big wear on one area and not on the other, then that's one easy, clear indication. The pain is another indicator. Like if every time I walk for 30 minutes or for 5 minutes, the pain comes back. So that's a good indication that it's not going to resolve itself. It won't go away. That we need to do something about it earlier, where it may get worse. So just two little suggestions there.
Okay, awesome. Lots of really great advice. Anything else you'd like to add before we sign off?
Yeah, to those guys that are thinking, is this really needing therapy? Do I really need to go get my doctor check me out, and go through all of this stuff? It doesn't have to be 17 weeks of intense therapy. It could just be a process where we identify there's a problem, you catch it early enough, and with just some light instruction and maybe moving you in the right direction, it could be something that's going to be resolved without so much so much long, tedious
Yes.
processes to get you back to where you want to be. So
Right.
just I know a lot of guys would say, like, I'm another one. I'll have to have a broken leg before I go do anything about it, or go see a doctor. But it doesn't have to be like that. Just kind of suck
Yeah.
it up. Spring is not too far away, and people are going to be wanting to get out there and enjoy the better weather and be more active. So this is a great time. If there's any kinks, any catches, anything that's not feeling right, it's a great time for us to help you improve that and get you ready for the spring and summer.
Right. Well, thank you so much, Mark, for
Mhm.
joining us today. Like he said, we have a runner's clinic on February 18th at the clinic here from 8 to 10 a.m. And we'll be, the therapist will be doing stride analysis. So I think it's a really great tool for those runners out there to get you ready for the spring season. So thanks so much for watching. We'll see you next time.